Since its founding in 1948 as a ministry of the Episcopal Church, Bishop Anderson House has been a place where healthcare meets the human spirit, providing chaplaincy, spiritual care, visitor training, and even teddy bears to those in need of support and healing. For a look inside Bishop Anderson House, let's welcome Reverend Thomas Rogers, who became Executive Director in 2015. We also welcome Reverend Michael Smith, Bishop Anderson House's chaplain at Stroger Hospital in Chicago. Tell us a little bit about the history of the Bishop's House and how it got started.
Sure. The very short version is we were actually founded by a gift from Bishop Anderson's daughter. Bishop Anderson was the fourth bishop of the Episcopal Diocese of Chicago. And today we do three things. One is we provide professional chaplaincy at Stroger Hospital of Cook County. We train lay people in the art of spiritual care through our spiritual care training program. And we also do spirituality and wellness. So we help medical staff throughout the Illinois Medical District get back in touch with their vocation. We know the research talks about how there's so much burnout with healthcare workers. So to give them a space to get back in touch with their vocation as caregivers.
And who is Bishop Anderson? A little bit about him.
So Bishop Anderson really was active in social justice. So he was very committed to the ecumenical movement. So that's why we have staff that represent the diversity of the Christian tradition. And our board is starting to get more diverse in terms of being more interfaith even. And so it feels really good that we're still living into those values that he espoused all those years ago when he was the Bishop of the Diocese of Chicago.
And Michael, you are the chaplain at Stroger Hospital, the only board certified chaplain, is that right? Tell us about what you do on a daily basis.
Well, right now my units are the trauma unit, burn, medical ICU, and pediatric ICU units. So on a daily basis, I'm around to see patients, to see how they're doing, providing support to patients, their families, and the staff to support those various units. Tell
us about some of the patients that you've been able to provide care to. Anyone stand out to you, and what kind of challenges do you face? One of the greatest challenges is that I am the only board certified chaplain present. So in those units, when I'm not present, there's not spiritual care provided for the patients or staff. So I take very seriously the time that I spend in my units each week. An average day would really encompass the morning, visiting all the new patients who come into my unit, revisiting those who requested a new visit, and checking in with staff. They're very busy, so it's never a set time that I see the staff of those units, but when they say, "Chaplain, can I speak to you for a moment?" or I may notice that they're really having a moment, I'll take the time to talk to them, see how things are going. For me, part of the joy, I mentioned I serve the pediatric ICU unit, and so that's where the teddy bear ministry really comes into effect. A lot of these patients are small children. And you can appreciate they're scared. Medical staff is coming in doing what they need to do to heal the children, but it's terrifying for children, also even sometimes for parents. So to come in, to speak to the parents, to find out how they can be supported spiritually is great for the parents, but to give a child a teddy bear, and it doesn't matter if it's a boy or girl, everyone wants a teddy bear. So to give that small child a bear that they can hold on to and really just have something that brings them a sense of normalcy during that time in the hospital is important. I would imagine it brings so much healing to these patients. We often think of the medical care, but the spiritual care is so very important, I would imagine, to the steps of healing. Yes, especially for patients who are persons of faith. Studies have shown that for persons of faith, it gives them a sense of strength, comfort, a sense that though I'm going through something very difficult, I can see the end at some point. And so to help them understand and to reflect upon how their faith can be a point of strength has been very critical for a number of patients that I see on a weekly basis. And Tommy, on your website it says, healthcare meets the human spirit. That is your goal. Right. Can you explain that?
You bet. Actually, it goes all the way back to our founding in 1948. The first executive director, Bishop Anderson House, was very interested in how those two things came together. And today, the way we live into that is very similar to what Chaplain Michael just shared, of how does the human spirit thriving impact patients' recovery? How does it impact families and coping with a new illness and a new normal if they've been in the hospital for various reasons, whether that be trauma or unexpected surgery? And so that's what gives me great joy. And kind of getting in touch with our spirit is far beyond any religious tradition. So it allows us to kind of access that common human experience of, we all know what it's like to hurt, and to be able to be there with people in some of the most trying parts of their lives and get in touch with their spiritual resources to help them in their recovery and to help them soar. And
caring for the caregivers, they're under probably a lot of tremendous stress. Tell us about that part of your ministry.
You bet. Well, it actually started about 4 years ago. And what we currently do is we will host a self-care day. So for about 2 hours, we'll have someone come in, do maybe mindfulness-based stress reduction, yoga, tai chi. And what we do is we ask staff to come in 15-minute windows. Maybe a block of 15 or 20 staff come in for these windows. And they just get a chance to eat some healthy snacks. They get to learn about how they can do some simple stretching to help them sort of manage stress better in their bodies. And just a way to say thank you for all the care that they give to patients and families. And it's so appreciated just to have that little break and that little thank you. It seems like something very small that we do, but has a big, big payoff.
A little bit of relief for them, I'm sure.
Absolutely.
And Michael, tell us a little bit more. You said you also provide chaplaincy to the staff.
A lot of staff vicariously experience the trauma of their patients. If you're in the trauma unit and this is your third gunshot victim of the week or the second of the day, we're all human. And while they're professional and they're providing that care, at a certain point it begins to wear down on even the most professional doctor or nurse. And so it's critical that in the midst of their care, they're receiving support. We often experience what they call compassion fatigue. After a while, you can lose the ability to sense that this is not just a patient, but a person who is hurting. This is a family who's maybe experienced now a third or fourth family member in a short period of time who's now in the trauma unit. And so it's important that we are sensitive to the needs of the nurses, the doctors, the technicians, even those who bring the trays in with the food. We often don't think about that, but even someone who brings in a tray to a patient is experiencing that trauma because they're seeing the injury that someone is experiencing. So for me, it's very important to check in with staff to say, well, how is your day going? Oftentimes it's something as simple as sharing a compliment from a patient. I may have spent an hour with a patient and they're talking about how their recovery is going and how nice the nurse has been and how she's really gone out her way to make that patient or family really feel they're getting the best care. So sometimes it's simply just stepping out the room and saying, just want you to know your work has been seen, it's appreciated by your patient. Because oftentimes we don't hear that thank you, or we're so quickly moving from one fire to the next, so to speak, that you don't hear a chance to say, you're doing a great job, or to say, hey, take a moment, breathe. What can I do to support you? They're so busy giving of themselves and pouring out that sometimes we have to make sure that they're being also, again, cared for.
And Tommy, you also mentioned spiritual care visitor training. Can you tell us a little bit about that?
You bet. We have a program for lay people who are interested in learning the art of spiritual care. Well, one of the things I've found as I visit different churches is people want to care. They want to support people in times of crisis, but they don't feel like they have the tools. So for the last 26 years, we have this program that was developed long before I got to Bishop Anderson House, but we've revised it. And people come together for a one-day retreat and learn some of the basics of spiritual care. And then there's 7 online learning modules that they take. And then through these learning modules, they learn different components of spiritual care, how to be with people in crisis, how to be with people towards the end of life, and even moving towards death. And the other thing we do is we support students in that program with a monthly chat with a chaplain. So we don't just put them in these learning management modules and then say, you know, enjoy. That's right. Hope you figure it out. But we also supplement it with some time where they can ask questions of a board-certified chaplain, like if a visit didn't go like they planned. And it really helps a congregation sort of increase capacity, because so many churches are smaller now. With a part-time priest or pastor, they can't meet all the spiritual needs. So to have a team of trained lay people who can step in and can provide spiritual support also really assists pastors, especially in smaller congregations.
How long is that process or the training?
It's really up to a student. So the one thing they do live is the retreat day, and the next one's going to be February the 1st, 2020 at the Bishop Anderson House office there at Rush University Medical Center.
Thank you, Tommy and Michael, for sharing your stories and more about the Bishop Anderson House.
Thank you.
Thank you.
I'm Anne Marie Gerhardt for Different Drummers and the Greater Chicago Broadcast Ministries. Keep the faith.